This is my mononucleosis test procedure explanation. And for this test, I will specifically be referring to the QuickVue Rapid Mono test. So for this test, you will need a reaction unit, a developer solution, alcohol wipes, a lancet. You'll need disposable gloves, gauze pads. You'll also need a biohazard sharps container, as well as a Band-Aid. And for this method, we will be using a capillary transfer tube since we will be obtaining a blood specimen from capillary blood in a skin puncture. So the first thing you'll want to do once you've laid out all of your materials and your supplies is you'll want to open the reaction unit to ensure that it's ready for use. You will also want to perform hand hygiene and apply gloves. Once you've applied your gloves, you're ready for your skin puncture. Make sure that you choose either the third or fourth finger on the patient's hand. You can begin to massage the finger from the base all the way to the tip of the finger. And once you've established a good blood flow to that puncture site area, you will then want to clean that area with an antiseptic wipe and make sure that you allow it to dry completely. So once you've done that, you're ready to poke your patient's finger. You will want to take your lancet and place it on the side of the patient's finger towards the center, perform your skin puncture, and immediately place the lancet into the biohazard sharps container. Then you'll want to wipe away the first drop of blood, and with the second drop of blood, you'll want to use that for your mononucleosis test. So what you'll do then is you will fill a capillary tube with blood, and you'll want to dispense all of the blood into the add well on your QuickVue Rapid Mono test. So once you do that, you can then go ahead and apply gauze on the patient's finger, and you can have them hold the gauze there and apply pressure. So then you'll want to add 5 drops of the developer to the add well, and so that's the same area that you just applied your blood specimen. And once you've done that, then you'll be able to read the results at 5 minutes. So really quickly, talking about reading the results, a positive result is any shade of a blue vertical line that forms a plus sign in the read result, as well as having a line and a blue line, in the test complete window. So that's a positive result. A negative result would be there's no blue vertical line in the read result window, and the blue line in the test window is complete as well. So an invalid result would show up after 10 minutes, and there would be no signal in the test complete window, and there would also be a blue color that fills the read result window. So make sure that you have read your patient's results. Make sure that their wound has clotted properly, and you will bandage that up for them. You also want to make sure that you've disposed of all of your materials into the proper waste bins, and then you want to document your patient's results in their medical file.